In this podcast episode, Dr. Robin Carhart-Harris, a pioneering neuroscientist in the field of psychedelic therapy, shares his insights on the revolutionary potential of psychedelics to treat depression and other mental health disorders. The discussion traverses the scientific, psychological, and cultural dimensions of psychedelic medicine, highlighting its promise as a transformative approach in psychiatry, especially for treatment-resistant conditions. Dr. Carhart-Harris begins by recounting his personal and professional journey into the field. His initial curiosity was sparked by a youthful experience with LSD, which opened his mind to altered states of consciousness. This personal encounter led him to study depth psychology and psychoanalysis, disciplines that explore the unconscious mind and the deeper layers of human psyche. However, he found traditional psychoanalysis somewhat lacking in scientific rigor and sought to bridge the gap between the mind's subjective experience and the brain's biological mechanisms. His collaboration with experts like David Nutt and support from organizations such as the Beckley Foundation enabled him to conduct groundbreaking brain imaging studies on psychedelics. These studies have been crucial in moving the field beyond anecdotal evidence to a mechanistic understanding of how psychedelics affect brain function and structure. A central theme of the conversation is Dr. Carhart-Harris's entropic brain hypothesis, which posits that psychedelics increase the brain's entropy, a measure of disorder or randomness in neural activity. In normal waking consciousness, brain activity is relatively ordered and constrained, allowing for stable patterns of thought and behavior. Mental illnesses like depression and PTSD often involve rigid, inflexible neural patterns that trap individuals in maladaptive ways of thinking and feeling. Psychedelics, by scrambling these patterns, temporarily increase brain entropy, leading to a more flexible, less constrained state of consciousness. This state allows individuals to break free from entrenched mental habits and gain new perspectives. The analogy of a system reset or factory reset is used to describe how psychedelics can recalibrate the brain's parameters, potentially restoring a more adaptive default mode of functioning. Importantly, Dr. Carhart-Harris clarifies that psychedelics do not turn off brain regions like the default mode network, DMN, often associated with the sense of self or ego. Instead, they disrupt the regular, predictable activity within these networks, leading to a more disorganized but liberating brain state. This neurobiological flexibility is thought to underpin the profound psychological and spiritual experiences reported during psychedelic sessions. While the biological mechanisms are critical, the conversation emphasizes that the psychedelic experience is not merely a biochemical event, but also deeply psychological and spiritual. Dr. Carhart-Harris highlights the importance of emotional release, psychological insight, and spiritual awakening as key therapeutic components. These experiences often involve confronting repressed emotions or traumatic memories in a supportive setting, facilitating catharsis and healing. The parallels between psychedelic states and advanced meditation practices are also discussed. Both can suppress activity in the DMN, leading to a diminished sense of ego and a feeling of connectedness with the world. Psychedelics may offer a shortcut to these states, which traditionally require years of dedicated practice to achieve. The podcast delves into the clinical implications of psychedelic therapy, particularly for depression, anxiety, PTSD, and addiction. Dr. Carhart-Harris shares encouraging results from trials where just 1 or 2 psychedelic-assisted therapy sessions have led to sustained remission in patients who had previously failed multiple antidepressant treatments. This contrasts sharply with conventional psychiatric medications, which often require chronic use and provide only partial symptom relief. However, he cautions against oversimplifying the treatment as a one-and-done cure. Complex cases, such as those involving personality disorders or severe trauma, may require longer-term therapeutic engagement and multiple sessions. Psychedelic therapy is most effective when combined with psychotherapy, emphasizing the importance of set and setting, the mindset of the patient, and the environment in which the experience occurs. Dr. Carhart-Harris also discusses the psychosocial matrix surrounding patients, including their life circumstances and social support, which can significantly influence treatment outcomes. Without addressing these broader factors, psychedelic therapy alone may not be sufficient. The conversation touches on various psychedelic compounds, including psilocybin, LSD, MDMA, ketamine, ibogaine, and 5-MeO-DMT, each with unique properties and potential indications. For example, ibogaine is noted for its use in treating addiction, while 5-MeO-DMT is described as an intense, short-acting compound that induces a state of pure consciousness or white light experience, akin to near-death phenomena. Dr. Carhart-Harris envisions a future where clinicians have a briefcase of psychedelic medicines, selecting the appropriate compound and dosing regimen tailored to the individual's condition and psychological profile. This personalized approach acknowledges the complexity of mental health disorders and the need for nuanced treatment strategies. Despite the promise, the podcast does not shy away from discussing the risks associated with psychedelic therapy. Impaired judgment during the experience can lead to accidents or psychological destabilization, especially if conducted without proper supervision. There is also the potential for iatrogenesis, where therapy inadvertently worsens symptoms by unearthing trauma without adequate support. The importance of integration, the process of making sense of and incorporating the psychedelic experience into everyday life, is stressed as a critical component of successful therapy. Without integration, the benefits may be short-lived or incomplete. Looking ahead, Dr. Carhart-Harris expresses optimism that psychedelic therapies will become mainstream within the next 5 years, with psilocybin and MDMA likely to gain regulatory approval for depression and PTSD, respectively. He foresees a more sophisticated understanding of the brain mechanisms involved, aided by advances in brain imaging and machine learning. His lab is working on decoding brain activity during psychedelic experiences to better predict therapeutic outcomes and personalize treatments in real time. The conversation also acknowledges the broader paradigm shifts occurring in psychiatry, including the rise of metabolic psychiatry, which addresses brain energy deficits and inflammation as contributors to mental illness. Together with psychedelic therapy, these approaches represent a quantum leap forward in understanding and treating psychiatric disorders.